we're going to be talking about the types of stridor today. So there are three types of stridor, mainly inspiratory stridor, indicating that the patient has an obstruction at the supraglottic region, biphasic stridor, telling us that the patient has obstruction at either the glottis, subglottis, or cervical trachea. Examples of pathology in these lesions are subglottic stenosis or tracheal stenosis, or the patient may have expiratory stridor in which the obstruction is at the level of the thoracic trachea. Listen carefully to these videos and see what type of stridor did the patient has. This lady here has biphasic stridor. Indicating that the level of obstruction is either at the glottis, subglottis, and cervical trachea. And this gentleman here has inspiratory stridor. He's talking. Indicating that the obstruction is at the level of the supraglottis. Various pathologies can cause this, for example, laryngocarcinoma or even acute epiglottitis. This is another example of a patient presenting with inspiratory stridor, and you would be able to see signs of respiratory distress such as intercostal recession as well as subcostal and sternal recession. This is another example with a classic croup, barking cough, as well as inspiratory stridor. As a rough guide, the louder the stridor is, the worse the obstruction is. We can also use some functional classification in which stridor occurring during sleep is milder compared to stridor occurring on exertion, and this is milder compared to stridor occurring at rest. So stridor occurring at rest is by far severe stridor. If the patient has presented with signs of respiratory distress such as tracheal tug, intercostal recession, subcostal recession, and sternal recession, this suggests that the patient has severe type of stridor.